Hey fellow twigs and brotches, it's Tom from Strength Ministry, back again. It's Tuesday, so you know what day it is, you know what title it is. It's Tom's Technical Tuesdays. And today we have a very special one for you. Similar to what we talk about in the squats, the squat versus the back squat versus the front squat. Today we're talking about the sumo deadlift versus the conventional deadlift and the differences between the two. And should you do both? Okay, first I want to talk about the muscles involved in these movements. The main muscles involved in these movements are the erector spinae, the lower back, the hamstrings, the back of the leg, the quadriceps, which is the thighs, the front of the leg, the tibius anterior, which is the front of the shin, and the gastrocnemius, which is the back of the back of the shin or the back of the lower leg. Okay, so first we want to talk about the technique of both movements. First and foremost, the conventional deadlift. If people don't know what this is, okay, I'm going to just describe to you and put a picture in the thumbnail as well to tell you what it is. So, first, your feet are shoulder width, pointing outwards, just straight on. Your grip is outside of your legs, so just more than shoulder width. So, for example, your feet are here, your hands are here, and in this position here, as I'll describe a bit later on, you work muscles slightly different to the sumo deadlift, which the sumo deadlift is with your legs further out, with your toes pointing outwards like this, and also with your hands or your grip inside the thighs. So your grip is closer than the conventional deadlift. For most people, that is. There is some exceptions. Okay, now there was a study done by a guy called Edgar Miller and colleagues, and he showed the difference in muscle activation or EMG. Basically, it was EMG study, showed the difference between muscle activation of the sumo and the conventional, and I'm here to tell you the differences. So, the sumo deadlift showed greater muscle activations in the vastus lateralis, which is the outer side of the quad. Now, in terms of percentages compared to the conventional, it is as so: 40% was the conventional deadlift, and 48% was the sumo deadlift in terms of overall maximum output of the quads, or the vastus lateralis. Excuse me. Moving on, the vastus medialis, which is that teardrop muscle inside of the quad, that's small. That's probably the smallest muscle on the quads, just inside of the leg. They showed 44% of output for that little muscle there, compared to 36% on the conventional side. So there's a big difference there too. Third and lastly, the tibius anterior showed dramatic difference, which is, like I said, the front of the shin earlier on in the video. This showed 18% activation compared to 13% on the conventional deadlift side. Okay, so we got that. Moving on to the conventional deadlift. Now, the conventional deadlift showed massive differences in two muscles. One, the erector spinae. Now, this was massive. This showed twice the activation compared to the sumo deadlift. Second is the medial gastrocnemius, which, if you don't know, is basically the calf muscle, but just inside. So the inner side, medial, meaning in. So the differences was 26% of conventional compared to 19% sumo deadlift. So for now, they're the differences between the two movements. Just want to touch on the glutes. Now, there wasn't really any massive difference or any kind of difference with the glutes. The glutes activated exactly the same on both movements. Same things for the hamstrings, apart from the inner part of the hamstrings, which the sumo deadlift showed a little bit more activation for the sumo deadlift compared to the conventional. But overall, the hamstrings and the glutes at very, very similar activation. Okay, so now we got that. What also we're going to be talking about is basically the vertebrae and the shear load on the vertebrae. Now, first and foremost, I just want to say that the sumo deadlift at 8% less shear load on the vertebrae, probably talking about more towards the lumbar vertebrae, which is the lower back, compared to the conventional deadlift. The reason being is when you think about it logically, you're more upright and the spine doesn't need to flex as more. So what I'm trying to say, in a conventional, if you used to picture this, in a conventional, most people start more tilted. So there's a lot more range there to finish the movement than a sumo when people start more upright and they just need to lock it out because it's a shorter range of movement as well. So yeah. So all I want to say, and I just want to talk a little bit about injuries. And if anyone has any little minor back injuries, now I recommend you take some rest, number one. But number two, I used to have a back in. I still kind of do. It's always there. But now I always sumo deadlift personally. The reason being because there's that reason of that, the sheer load on the spine or the vertebrae, excuse me. And I used to do conventional, but as soon as I switched to sumo, I don't have any problems anymore. But just little nicks, which was because of my conventional deadlift. But I'm not saying don't do conventional, but for me personally, this is why I do the sumo most of the time. Okay, so what can we take of this, or what can we just conclude of this? Well, the sumo deadlift overall has more quad activation, as mentioned earlier on, the vastus medialis, the vastus lateralis, and also has more tibialis anterior activation, but most people don't really care in terms of the lower legs anyway, in terms of activation. They probably care more in terms of the upper body, the upper lower body. But I will still mention it to you because I think it's still important. Same thing with the same thing earlier on as mentioned. The conventional has more lower back and gastrocnemius work or activation compared to the sumo. So that's what we can take of this. What is this study telling you? From my point of view, it's just saying if you want to, specifically work different parts and possibly add a bit more poundage or a bit more activation in certain areas like the quads, do the sumo. Like vice versa. You want more erector spinae work, do more, conventional. However, I do not recommend just doing one movement, or unless you physically can't do the other movement without possibly injuring yourself. Like myself, I'm a little bit, to be honest, I'm a little bit scared to do conventional deadlifts now as I pull my back doing it. Another thing to note in the study, going back to it, is that this was done. This is maybe a little bit of a flaw in the study, possibly. This was done on a 12 rep max. Okay, it was exactly the same weight was done. So individuals done exactly the same weight for both the sumo and conventional. Now, from people that know the differences within deadlifting, you're going to be stronger, in my opinion, in one movement than the other. Most people are more built for conventional, so they might be strong in this movement because it involves more lower back as opposed to, which is a lot more stronger than the quads. But what we can take from this, as I was saying, is that don't stick to one movement. Vary your deadlift training. 1 week sumo deadlifts, another week conventional deadlifts. See what one you're best at and stick to that. And also don't forget to involve accessory exercises for the deadlift too. But then again, doing sumo can be an accessory for the conventional and vice versa. So guys, that's this week done. That's the sumo deadlift versus the conventional deadlift. We spoke about muscle activation on both movements. We spoke about shear load on the vertebrae. We spoke about possibly if you have any niggles, any injuries in the lower back, or just any back pain in general, possibly do the sumo deadlift over the conventional deadlift. And yeah, this is it. And so guys, don't forget, you know what I'm going to say to you. Don't be a twig, be a branch. Tom, Strength Ministry at